course, a great way to prevent it. Also, the aluminum in antacids that people take for ulcers seems to be associated with the onset of Alzheimer's, and so does a high-fat diet, because the fat clogs up the arteries and then the brain can't get enough oxygen. Seizures seem to be intensified by sugar in the diet, by the excitotoxins, MSG and aspartame, by food additives, by a lack of nutrition, and by a lack of water, dehydration, and possibly caffeine. These are problems that many women have. Fibrocystic breast disease is accentuated by having caffeine in the diet. Now, that's not only from coffee and caffeinated soda, but there is a caffeine-like compound in tea and in chocolate. So all of these things must be eliminated. Also, fibrocystic breast disease is increased by a high-fat diet. Any tumors, whether benign or malignant, are abnormal. By getting your body back in balance, by eating right, by living right, your body can get rid of those tumors. You don't have to always have them cut out. Menopausal hot flashes. I had terrible hot flashes. I tried to get off my estrogen replacement therapy many times, but I would have such hot flashes I couldn't stand them. But when I found out I had breast cancer, I knew I had to stop those estrogens immediately. And I was dreading what would happen to me when I stopped the estrogens. But as soon as I changed my diet to a totally vegan diet, no meat, no dairy products, no eggs, no poultry, no fish, I never had another hot flash. And of course, you want to drink a lot of water as well. There are some herbs that are helpful in decreasing menopausal hot flashes, such as dong quai, blue cohosh, black cohosh, wild yam root, fennel, and licorice root. However, I think that what we should do is try to get our body back in balance and not even use herbs as drugs. If you decrease the fat and the protein in your diet and you eat a natural diet, almost always the hot flashes will go away. But you say, well, I don't want to get osteoporosis and my doctor tells me I've got to be on estrogens. Well, osteoporosis is not caused by a deficiency of estrogen. In fact, as we discussed before, osteoporosis is caused mainly by lack of activity and too much protein in the diet, particularly too much animal protein. So if you will get your diet down to eating less than 40 grams of protein a day, then you won't get osteoporosis. Of course, you want to also eliminate the medications like cortisone that cause osteoporosis, and of course smoking causes osteoporosis and caffeine contributes to it. So you want to rectify those factors, but you need to get exercise and you need to get the proper amount of protein in the diet. You don't want to keep taking calcium because osteoporosis is not a calcium deficiency per se. What happens, as I said, is that when you eat too much protein or you drink too much milk, the body becomes very acid and it has to take the calcium out of your bones to neutralize the acid. Now, a lot of women say, well, my doctor has put me on Fosamax. Well, if you go to the physician's desk reference again, the PDR, the big red book, you will find that Fosamax causes ulcers of the esophagus, abdominal pain and gastritis, that's inflammation of the stomach, bone, muscle, and joint pain, headache, dizziness, and acid regurgitation of your food. Fosamax will not cure your osteoporosis. Osteoporosis is not due to a deficiency of Fosamax. What it is due to a deficiency of the proper nutrients, and you want to get rid of the excess bad food in your diet. Now, infertility can be rectified by the total plan that we're going to talk about. Male and female mice exposed to MSG early in life actually suffered from infertility in laboratory experiments. There is some evidence that fluoride, particularly fluoride in the water and in toothpaste, contributes to the infertility problem, and also a lack of antioxidants. Well, the antioxidants should be in the food that you eat, not necessarily in supplements, because those aren't natural. The nausea of pregnancy is in large part caused by dehydration. When a woman gets pregnant, her body has to take huge amounts of water from her cells to form all the amniotic fluid for the baby. When you get dehydrated, you can get nauseated. So you want to make sure that if you're contemplating becoming pregnant, make sure that you are drinking lots of water, your body is well hydrated, and that you are eating proper nutrition. And then premenstrual syndrome. Actually, this is also truly cured by getting your body back in balance, by getting the stress out of your life, drinking lots of water, exercising, and eating an all-natural diet. Estrogen replacement therapy, as we talked about for menopausal hot flashes or to try to prevent osteoporosis, these cause cancer of the uterus, breast cancer, abnormal blood clotting, nausea and vomiting, enlargement of uterine fibroids, and sometimes spotty darkening of the skin, particularly skin of the face. These things are easily solvable by getting yourself back on schedule, getting the body back in balance. They are never solved by drugs. It seems like everybody's suffering from some kind of joint pain or back pain or neck pain. Osteoarthritis is somewhat different from rheumatoid arthritis. At least we doctors categorize it differently. But all of these really play into the same factors that cause them. Osteoarthritis and back pain and neck pain are basically due to inactivity, the wrong diet, and not enough water. You see, water is necessary to make synovial fluid. That's a special kind of fluid that the body makes to nourish the joint surfaces. When the joint surfaces get too dry, they wear out, and they can cause back pain and neck pain. But you can rehydrate those joint surfaces if they're not too bad. Sciatica is pain down the back of the buttock and down the leg, and is caused generally from a herniated disc or a slipped disc. That's because the discs are dehydrated, because people are not drinking enough water and the discs aren't being nourished enough by proper exercise. I had severe disc problems before I understood my need for water. I actually had them operated on a number of years ago, and then the pain came back. And when I moved to a hotter climate and I wasn't drinking enough water, my pain got severe. But as soon as I started drinking large amounts of water, over a number of months I was able to rehydrate the discs. And actually the discs plump up and they stop pressing against the nerve roots. You know, as women particularly get older, they get shorter. Well, how do they do that? It's because their discs collapse in between their vertebrae. But you can rehydrate those discs and increase their size and increase your ability not only to move about and have freedom from pain, but you can move that disc out of the way by its rehydration and plumping up so it's not pressing against the nerve root. Sugar also causes joint pain. It suppresses the immune system. It is very dehydrating, and you need the water for your nourishment of your joint surfaces. Caffeine is dehydrating. Alcohol is dehydrating. And of course, a lack of exercise, your joints get stiff if you don't move them. Lack of nutrients also can cause these diseases. You have to eat right. And sunlight gives you vitamin D to give you strong bones. Cortisone and the anti-inflammatory drugs will always make these things eventually worse, because even though they cover up the symptoms to begin with, they cause worse problems down the line. So what you want to do is the same old song. Eat right, exercise, and get rid of the stress in your life. And we'll show you how to do that total plan in just a minute.